Hello and welcome to the podcast series sponsored by Aster Hospitals. I am Pallavi. This podcast is all about CVI, chronic venous insufficiency. It's a condition that concerns the blood flow from legs to the heart. To understand this, we speak to Dr. Krishna Chaitanya, vascular and endovascular surgeon with over 10 plus years of experience, currently associated with Aster Hospitals, Bengaluru. Hello, doctor. Welcome.
Thank you, Pallavi.
So, doctor, in this episode, I want to understand what CVI is, the prevention tips, the symptoms, who is at risk, and everything.
Yes.
So, let's start with what CVI is. I think it's got more popular, I would say, maybe because of Donald Trump.
Probably. We don't know. See, CVI is an abbreviation which can be used for many things. Let us spell it out. It is chronic venous insufficiency. So, what exactly is this new Donald Trump syndrome? So, it is nothing new. Ever since man has assumed an erect posture, there is a challenge that our blood has to flow from our legs back to the heart or the lungs against gravity.
Right.
It has always been a challenge and a miracle. How does the blood go upwards? So, as we grow older or even due to certain conditions, its journey from the legs to the heart or the lungs gets affected. It can be blocked or it can be slowed down. And when this happens over a period of time, which we call as chronic, this is called chronic venous insufficiency, where the venous blood, the blood from the legs, the veins, is inefficiently going back towards the heart and the lungs. So that is what we call as chronic venous insufficiency.
So when you say that the blood has to flow against gravity, is there a link between heart health and the blood flow?
See, everything in our body is eventually connected to the heart. But can you suffer a heart attack due to chronic venous insufficiency? Unlikely. Very, very unlikely. Because this concerns slowing of blood from the leg to the heart. When we are talking about chronic venous insufficiency, this condition can affect a significant number of patients, especially those who are older than 65 years. So this directly may not affect the heart health in particular. But yes, the entire blood flow is connected with the heart. And those with certain heart conditions, due to increased pressure in the heart or when the heart pressures are high, that can rather affect the flow of blood from the legs to the heart. But this condition, when you talk about chronic venous insufficiency, it is not necessary that people are too scared about it, that it could cause heart attacks or strokes. It is very unlikely for that to happen.
Okay.
It affects the blood flow from both the lower limbs or both the legs, and if we can put that, back towards the body, or the circulation gets affected.
Who is more likely to develop CVI? Age, obesity, lifestyle factors? Does any of these contribute?
To understand that, let us look into what can cause CVI.
Right.
Correct? So, if we look at a natural process of aging, where our body tends to loosen up, our veins also tend to loosen up. There can be valves in the veins which act as one-way valves. They allow the blood to go up while prevent it from coming back.
Okay.
These valves can get weakened over age and they can become saggy. So the blood does not move up, it also flows back. So aging is a natural reason why people tend to get chronic venous insufficiency. Our veins become saggy, valves become saggy or loose, and the blood stagnates in the legs. So if you have an elderly person, towards the evening or the end of the day, some amount of swelling in the leg, or after a long distance travel, some amount of swelling in the leg is probably due to chronic venous insufficiency. That is what happens naturally. But there are certain conditions in which CVI can occur even in younger people. There could be an episode of deep vein thrombosis, any blood clot in the veins. Immediately there might not be CVI, but over a period of time, due to the blood clot, the vein could have got damaged, and that could be affecting the flow from the legs back to the lungs. So that is one of the reasons for chronic venous insufficiency. People with varicose veins, those who have varicose veins, they can develop CVI over a period of time. And people with obesity, what happens? We are talking about the blood flowing from the leg back to the lungs. Now imagine the same body a person, a 40-year-old man's body who is about 50 or 60 kgs, and the same 40-year-old man who is about 120 kgs. Now, naturally, the more is your body weight, it is more difficult for the blood to climb up because of your abdominal pressure, your chest wall pressure, because of the obesity. So, obese people are more prone to develop CVI in that way. Women are more prone to develop CVI. Now, there are reasons why women are naturally more prone to develop CVI than men.
Question, yeah.
Yes. So, we will answer that. So, these are certain conditions which can predispose to develop CVI. Obesity, sedentary life, people with previous history of clotting in the veins, those with varicose veins, old age. So, these are different age groups or body types where they can develop CVI.
You said varicose veins. Now, how does a common man understand that this is CVI, this is varicose veins, or is it interlinked? Please explain this.
Now, if I tell, chronic venous insufficiency is any condition which affects blood flow from legs back to the lungs, correct?
Right.
Varicose vein is one of the reasons to develop CVI.
Okay.
So, if you understand, yes, varicose vein is a condition which causes chronic venous insufficiency, but not all chronic venous insufficiency is caused by varicose veins.
So one of the reason is varicose veins.
Yes.
What are the other reasons, doctor?
The other reasons, as I earlier said, it could be a previous history of clot in the veins, obesity, or old age, several other factors.
Right. What are some early symptoms that people should watch out for? Who is at risk?
Women are more at risk, elderly are more at risk.
Why, doctor?
Yes.
Why women?
Why women is because the veins, along with all other blood vessels of the body, are under the influence of hormones, especially the female hormones. So there is always a distension and shrinking of the veins in response to the hormones.
Okay.
So this happening over their lifetime, active reproductive health can affect the vein health. The second factor is when the woman becomes pregnant. So there is always an increased buildup of pressure in the abdomen that can put back pressure on the veins.
Oh, that's why we've seen these cases where
women
the legs
during pregnancy swell up. Yes. They even get cramps at night during those times. So these are the reasons because the blood flow gets affected. So if some of these walls are getting damaged during pregnancy, or due to the hormones, the vein become too saggy, this can lead to a chronic venous insufficiency in the future. So these are the reasons. Multiparous women who have had multiple childbirths, are more prone to develop CVI than women who have fewer children.
Okay.
So women who have taken hormonal medications, either as a contraceptive method or for certain conditions like PCOD, where people take hormonal medications. These women also can develop weakness of the vein walls or looseness, sagginess of the veins, and they are more prone to develop chronic venous insufficiency.
Apart from women, there are other people who are at risk.
Right. The obese people, the elderly people. So we were answering a question, what are the early symptoms of CVI?
Right.
So CVI can affect in variety of ways. See, not all leg swellings can be because of CVI, correct? So there can be different factors. People with weak pumping action of the heart, or weak kidney functions, or weak liver functions can also develop leg swelling. But how do we know if this is CVI or not? Now, most of the people in whom there is chronic venous insufficiency tend to develop blackish pigmentation or discoloration around their feet and ankle over a period of time. They can develop itchiness in those areas where there is blackish discoloration. They might even see prominent veins. It could be tiny veins or bigger bunches of veins which they could see. And they can even see the skin around their ankles will start getting thickened. You cannot pinch the skin around the ankle. Normally we are able to pinch our skin because there is not much of it's elastic. So the skin around the ankles cannot be pinched when a lot of this blood starts leaking due to pressure and the protein starts getting deposited. The skin becomes thick, rock-like. So we call as lipodermatosclerosis. These are some of the symptoms which can affect progressively as the chronic venous insufficiency progresses.
So there is a possibility that people, like a common man, would mistake CVI to varicose veins, or when you talk about all these symptoms?
See, varicose veins can be a part of chronic
CV,
venous insufficiency. Yes, but it can. Your question is valid. I'm just trying to frame that. So, if I read it right, a person has visible veins.
Correct.
He thinks it is varicose veins. Could it be any other reason of CVI?
Yes.
Yes, certainly. Now, suppose we will look into a scenario where suppose somebody has had a block in the veins. It could be a block somewhere in the abdomen or iliac veins, or old missed deep vein, a clot in the veins which could be blocking the deep veins. These people can have varicose veins, secondary varicose veins. It's what. So it is a chronic venous insufficiency, not a primary varicose veins, which is, most of the people believe varicose veins are treated like magic by lasers. So these are some of the conditions where we call as secondary varicose veins, where the traditional treatment methods of lasers or sclerotherapy or phlebectomy may not be beneficial.
Okay, since you said about laser and all, that leads to another question of mine. So what are the treatment options
for varicose veins?
For CVI in general. And you can cover varicose veins too, doctor.
Okay. Treatment of chronic venous insufficiency depends on what is causing chronic venous insufficiency. For example, let us start with varicose veins. If varicose vein is causing chronic venous insufficiency, depending on the symptoms or the severity, there can be different treatment options. The first will be conservative. Now, when we look at CVI, what is happening? There is stagnation of blood in the legs, right? The impure blood, it is not going back. Now, how do we manage that? We apply a counter pressure.
Okay.
What we call as compression stockings or compression wraps or compression garments. These can apply a graded compression and thereby help prevent stagnation in the legs. So this is the simplest thing that can be done. Now there can be some medications which can tone up your veins and prevent leakages of the blood from your legs. Or if the severity is more, there can be invasive interventions. Traditionally, surgeries used to be done. Even now, surgeries can be done. It is time tested and golden way of treating varicose veins. But now, since people want minimally invasive techniques, we have gone minimally invasive. Okay. Now, one of those methods of treating these varicose veins in a minimally invasive way is what we call as laser ablation or EVLT or endovenous laser therapy, thermal ablation of veins. So what we are doing is, these veins are damaged, they are faulty. Instead of taking the blood below upwards, they are in fact leaking above downwards. So this is leading to more buildup of pressure in the legs, leakage of impure blood, leading to that skin changes, sometimes even wounds forming, not healing. So how do we get rid of them?
Right.
By surgery, we used to open and strip off these veins, remove them.
Okay.
Now, in a minimally invasive way, we use these laser fibers, or there are other fibers called radio frequency fibers, where through a needle hole, we pass these fibers and burn the veins and destroy them within the body. So there is no bigger incisions where you have to remove the veins or other things.
Right.
But if it is not due to varicose veins, then several other things, like if the patient has had a deep vein thrombosis, there is a clot. So compression stockings and medications become the mainstay of treatment. Sometimes elderly people, if we have seen that, the way we walk is very important. We have a second heart. Do you know, Pallavi?
Second heart?
Yes, we have one heart, everybody knows about it. But there is a second heart.
Okay, that is?
That heart is the calf muscles of our leg.
Okay.
This is called a calf pump. A very, very important heart when it comes to CVI. If you've seen, we naturally walk in a tandem way. Our ankles move when we walk. Right? Now this leads to rhythmic contraction of the calf muscles, which act as a heart to pump the blood upwards. Have you seen elderly people walking? They waddle like this.
Yes.
Literally no movement of the ankle.
Yes.
Now what is happening? There is no pumping of the blood upwards. This leads to stagnation, what we call as calf pump failure. One of the very commonest reasons why elderly are more prone to develop CVI. So what can you do about it? Strengthen your calf muscles, improve your ankle movements, do heel raise exercise. So these are some of the techniques where you can naturally improve your CVI condition. So by simply moving your like a tailoring machine, when you're traveling by flight, you have a card there to keep your ankles moving. If I don't know if you have read by long haul flights, there are cards to rotate your ankle, move your ankle up and down. The reason is to pump the blood so that the blood doesn't stagnate in your legs.
Right. Now I'll move to another segment, Doctor. These are the questions that people often look for answers on search engines. So basically they Google all these questions.
Yes, we have to answer the Google queries also these days. Yes, please.
Is CVI reversible or only manageable?
No, can age be reversed?
No.
Yeah, certain degenerative conditions, not just CVI, be it your osteoarthritis condition, your whatever it is, age-related degenerative conditions can only be kept under control so that they don't cause trouble. Now, what is trouble? It can decrease the quality of life. So, CVI is nearly not a killer. All right? People don't die out of CVI, but it can significantly impair quality of life. Now, if you keep it under control, your quality of life can significantly be better. So you can't, if some of the conditions cannot be completely cured, like CVI arising out of after a clotting of the vein may not be completely cured. So the initial treatment for clot becomes very important. If somebody has a deep vein thrombosis, clots, so the initial treatment is very, very important. Identifying at the right time, treating with the right medications, blood thinners, or some other strategies, so that the clot burden is less, all the clot disappears, and people don't suffer from CVI in the future. So it becomes very important, because once CVI occurs in such conditions, there may not be cure.
Okay.
Except that you can keep it under control with stockings and the exercises which we discussed earlier. But if the CVI is due to conditions like primary varicose veins, yes, there is a cure. You can treat the varicose veins and can definitely control CVI.
Okay. Does sitting for long hours or working from home, basically sitting, does this cause CVI?
Yeah, of late we have started calling them e-varicosities. We have software engineers sitting in front of the system for long hours. Basically a sedentary lifestyle where your calf muscle is inactive again. Yes, your blood is stagnating. What happens with stagnation is, if you can imagine the blood vessels which are, where the blood flows, because you're inactive, the blood starts piling up. When this blood starts piling up, they start stretching, your veins start stretching. When your veins start stretching, they also get leaky and you'll get swelling over a period of time. So you do this, one day of sitting may not make a difference, but it becomes your profession, it becomes your lifestyle. Yes, sitting for long hours without physical activity can significantly lead to development of CVI.
Can wearing high heels or tight clothes cause CVI?
Interesting question. High heels, yes, because as we discussed, when you wear a high heels, your ankle movement is reduced. So again, the calf pump function comes there in
second
the picture.
heart.
Yes, the second heart, you're just keeping your legs that way.
Right.
So it might affect second heart. So wearing high heels over a long period of time can definitely predispose to CVI. Now when it comes to tight clothings, depends on which exact part of the body the tight clothings are. If I have to give you an example, the traditional European dress where there used to be a tight cloth around your abdomen. Now this kind of clothing would affect the venous return from your legs to your heart, because the blood from your legs has to eventually go to your lungs, heart and the lungs, they work in synchrony. But if your dress is too tight around your waist or the abdomen, it can definitely put back pressure in your legs. So to prevent that, the traditional dress even used to have long leg stockings. So that would couple with this dress to prevent development of chronic venous insufficiency. But if somebody wants to look really slim and wears a tight fitting cloth only in the upper body, yes, it can affect the blood flow from the lower body. But if you want to prevent against stagnation, you better wear stockings to
Stockings.
counter that.
Are there any specific foods or diets that help in improving blood circulation?
Not that anything has been proved of, but certain, we call it as flavonoids, vitamin C rich foods. And these are some of the foods which are known to tone up veins. So they are generally, you take an antioxidant rich, vitamin rich, balanced diet, that should be more than enough.
Thank you, doctor, for sharing a lot of information about varicose veins and CVI. I think that's the most confusing part. Thank you so much for sharing a lot of information.
My
Doctor.
pleasure, Palvi. Thank you so much.